Hi everyone, I'm Rehman. I'm a consultant trauma and orthopaedic surgeon. I'm going to tell you a bit about knee replacement surgery. Knee replacement involves replacing the damaged parts of a knee joint with prosthetic implants. Now, bearing in mind for most people, the best knee you're ever going to have is a knee that you were born with. The best outcomes after knee replacement surgery only come if it's done for people with severe knee pain and stiffness as a consequence of a process that's severely damaged the cartilage and bone. Some of these common conditions include osteoarthritis, the most common cause. It's known to most people as wear and tear of the knee cartilage. Rheumatoid arthritis, which is an inflammatory disease which inflames and destroys human joints. Post-traumatic arthritis, which is wear and tear following a severe injury to the knee. Avascular necrosis, which is a very rare condition in the knee whereby the blood supply is compromised, leading to bone damage and cartilage damage. And if one of those is causing major disability, that's when knee replacement comes into play. Now, during surgery, I'll make a cut over the front of the knee. I'll remove the damaged cartilage and bone. There'll be a small amount of bone removed from the top of the leg bone and a small amount of bone removed from the bottom of the thigh bone. This is replaced with metals and plastics that fit the space best. When done by an experienced surgeon, this procedure is generally very safe and effective. There are, however, some risks that I'm going to go through. They might frighten you, but the intention is not to scare you off the operation, just to allow you to make a balanced, informed decision. Infection. Infection affects 1 to 2% of cases. We do everything in our power to prevent you from getting an infection. A bad infection will mean redo operations. Damage to local structures. Damage to local structures, including tendons, ligaments, and bones, is rare. If this happens, it can affect the stability of the knee. Damage to nerves and blood vessels is also very rare. If this happens, it can cause numbness and weakness in your leg and foot. Blood loss. Blood loss during surgery is generally very rare. I use a tourniquet in my cases, but even when a tourniquet isn't used, we can minimise blood loss. We do keep an eye on blood loss because excessive bleeding can put strain on the heart, causing a heart attack, and on the brain, that would be a stroke. Occasionally, a blood transfusion is required. The main risk of a blood transfusion is an allergic reaction to the new blood, which we minimise by type matching your blood. Blood clots. Blood clots are a very serious matter. Blood clots in the leg that travel up into the lung can be life-threatening. We will give you blood thinners after the operation to minimise this risk. You can help us by getting up and moving early on to keep the blood circulating. Implant wear and tear. Modern implants are very durable. I'd be very disappointed if your knee didn't last you at least 15 to 20 years. That being said, sometimes implants can wear down and debond from the bone earlier, and again, that would mean redo surgery. Stiffness. Stiffness after surgery is a more common problem. The way to prevent this is to do the physiotherapy exercises that our physiotherapists demonstrate. You're trying to avoid scar tissue forming within the knee, jamming it up, stopping it from moving properly. Actually, if you start physiotherapy before the operation, your recovery and rehabilitation will be augmented. Instability. Sometimes a new joint can feel wobbly after an operation, especially if the ligaments around the knee are weak. Again, physiotherapy plays a key role here. Fracture. Fracture or notching can occur either during the operation, or if you have a bad fall afterwards, you can break the bones around the implant. If there is a fracture intraoperatively, we'll fix it straight away. If you fall outside and break the knee, it can mean reattendance to hospital. Residual pain or new pain. This is very uncommon. It's important to note that knee replacement will improve all problems related to the knee itself. It will not cure problems arising from the back, hip, or nerves. Sometimes the wound itself can feel sensitive or tender even months after the operation, but this will improve. Massage therapy can be particularly useful here. Dissatisfaction. Dissatisfaction after surgery is uncommon. Some papers quote it as high as 20%, but that's not my personal experience. I think that probably reflects patient selection. I guess I should say here that implants perfectly mimicking a human knee haven't been invented yet, so if you have a decent amount of cartilage left, then it's best persevering with non-operative treatment. Everyone experiences numbness on the outside of their knee after a knee replacement. This never fully recovers, but is never really a problem either for most people. If you are able to kneel before the operation, you may well not be able to kneel after the operation, at least not without some sort of support. The implants can take the load, but the soft tissue around the knee doesn't really like it. Severe complications like limb loss or death are extremely rare after a knee replacement. Recovery after knee replacement is gradual. After surgery, physio starts as soon as possible. Most patients are on their feet the same day of surgery. Walking is encouraged early on because it can help with rehabilitation and minimise some of the risks. You may initially require sticks or crutches, but this is usually temporary. Most of my patients will stay about 24 hours in hospital, which means an overnight stay with knee replacement. Getting back into your home environment will indirectly reduce some of the risks associated with knee replacement. It's very important to note that you're not going to leave the hospital completely pain-free. You will be pain-controlled with painkillers. There will be some swelling around your wound. There will definitely be some swelling within the knee. There can even be some swelling in the ankle as gravity pulls the fluid downwards. If you get severe pain and swelling in the calf or high temperatures, then you need to be looked at by a medical professional. In the early few days after surgery, there can be a touch of blood spotting on the dressing. That's nothing to worry about, and you should be assured that the wound will withstand all the tension required for you to do physiotherapy. In my cases, there are staples that need to come out. They usually come out about between 10 and 14 days after surgery, and that's because the flesh heals by 2 weeks. Over the following 2 to 6 weeks, pain will steadily reduce, movement will improve, and your strength returns. You'll become more confident and independent. By around 6 to 12 weeks, any residual niggles should be gone. Most patients have resumed their activities of daily living and are quite comfortable by that stage. Now, improvement will continue over the following 18 months as long as you keep improving your strength and endurance. That improvement is less noticed by patients because the knee tends to feel very good by between 3 and 6 months after the operation. In terms of return to your life, the numbers I'm going to give you are arbitrary. It's not a one-size-fits-all. Most patients can return to work within 4 to 6 weeks. If you're desk-based, you may be able to get back to that a little bit earlier. Physical roles will take a bit longer. You can usually return to driving by about 6 weeks. Once you're off strong painkillers, you no longer need mobility aids, and you've got the strength in your leg to do an emergency brake. We always advise checking with your insurance company and the DVLA, as the surgeons don't set the law in this practice. Exercise can begin immediately with walking and physiotherapy. Low impact activities like swimming, cycling and gym are typically safe from around 4 to 6 weeks. Avoid high impact activities like running and jumping early on. Your implants do contain metal and may be detected on airport scanners and security alarms. There's no cause for concern, you just have to let the staff know you've had an operation. They're very familiar with this. I hope this video has been informative and hasn't terrified the life out of you. Knee replacement is a highly successful operation and does transform lives. For the majority of patients undergoing knee replacement with me, they seem to be very happy. If you're considering knee replacement or you're about to have one done with me, I wish you all of the best on your journey to recovery.